All right, so as you all know, a theme of recent days is that everything is falling apart right in front of our eyes. The U.S. has rolled back the clock and gone full 1800s-style imperialism. That's one thing to keep your eye on. Scams are now legal vis-a-vis crypto. The president is a crypto scammer. So, again, horrible. Things are getting worse. We're rolling the clock back. But here's another way in which we're rolling the clock back that is absolutely terrifying. So this is in The Guardian. Kansas reckons with large tuberculosis outbreak as health officials hamstrung. Experts fear consequences of Trump's restrictions on CDC as state sees one of the largest outbreaks ever recorded in the U.S. Tuberculosis, for those of you who don't know, this is one of those illnesses that is way more common in developing countries. We would have very, very few cases here in the U.S., but now we're having our worst outbreak. Again, what I say, we're rolling that clock back, baby. We are rolling that clock back. Here we go. Listen to this. Kansas is experiencing one of the largest TB outbreaks ever recorded in the U.S. as public health powers at the state and federal level have been greatly curtailed. Outbreaks like these may become more common and dangerous as officials' efforts are hamstrung and their communications are limited, experts say. You can think of TB outbreaks like a canary in the coal mine of our public health infrastructure, said David Dowdy, a professor of epidemiology at Johns Hopkins Bloomberg School of Public Health. What causes them to happen is a weakening of our public health infrastructure, which, by the way, exciting that RFK is going to be head of Health and Human Services, isn't it? Isn't that exciting? A guy who thinks raw milk is better than pasteurized milk for you? A guy who's deeply anti-vaccine? Really good stuff, huh? Since January 2024, there have been 67 active cases of tuberculosis identified in 2 counties in Kansas, more than the usual case count for the entire state in a year. Despite the counties together representing less than 3% of the state's population, according to U.S. Census data from 2023. Quote, "It's definitely more than just a little blip," said Dowdy. "It's one of the largest outbreaks of tuberculosis we've seen in the country in the past 30, 40, 50 years. The state has also detected at least 79 latent cases of TB in which patients do not display active symptoms but may develop and spread active disease later." That's great. Guys, when I think of tuberculosis, I think of like the old Wild West. I think of like Doc Holliday in the movie Tombstone. You know, this is not something that was like a modern concern. The state is currently monitoring 384 people who are undergoing testing and treatment. Public health officials in Kansas and from the U.S. Centers for Disease Control and Prevention are working together to mitigate the risk of TB in the community and ensure the safety of all individuals. Jill Branaugh, communications director for the Kansas Department of Health and Environment, said in a statement. But the risk to the general public remains low, she said. Quote, "We are working with schools and businesses to help prevent the spread of TB by supporting efforts to monitor symptoms and provide education. It's an uphill battle in a state that has seen public health powers sharply reduced in the wake of the pandemic." You would think the opposite, right? In a functioning country, if we have a horrible pandemic, in the wake of that pandemic, one of the things you would do is beef up your public health powers. But we did the opposite because we're a failing nation. The Kansas governor was banned from closing down businesses during the public health emergencies in 2021, and the legislature forbade state and county public health officials from mandating tests, isolation, and closures due to infectious disease in 2023. That's good. Good stuff. So they are pro-virus over there in Kansas. Tuberculosis tends to spread when people spend a lot of time in crowded conditions, such as prisons, jails, and homeless shelters. These are also places where people frequently lack access to adequate health care, which can make infections more likely. Other factors such as malnutrition, HIV, AIDS, and other immune-suppressing conditions put people at greater risk of getting sick. But what really causes TB outbreaks is the inability for public health professionals to respond, Dowdy said. It's not that we don't know how to do it, Dowdy said of treating TB patients and keeping the bacteria from spreading. It's about the conditions underlying this that enable these outbreaks to unfold. When there is a way to detect the first cases and there are enough health workers to trace and test contacts and to support patients who test positive, outbreaks can be stopped before they even start. But when the systems are incomplete or dismantled and there are not enough health workers or resources to go around, it's easier for these sorts of things to go undetected for a longer period of time. The people in Kansas are doing a good job with this. They just don't have the resources they need. At the national level, the Trump administration limited what the CDC and other federal health agencies can do by instituting a communications blackout in its first weeks. Isn't that great? That's awesome. The ban on external communications includes withholding the release of the Morbidity and Mortality Weekly Report, a highly regarded epidemiological digest that updates the public and medical practitioners on emerging and continuing outbreaks among other cities. That's awesome. Good stuff. On Friday, hundreds of pages were also removed from the health agency website. websites to comply with Donald Trump's executive order to remove references to race, gender, sexual identity, and disability. I don't even know what to say to you guys, bro. This is failing nation shit. That's what this is. All right, but I'm not done. So we're talking about tuberculosis here. Wild West Doc Holliday shit. Stuff that in the year of our Lord 2025, people would think like, what? Nobody gets that anymore, right? Okay, well, what about this one? Ready? Measles outbreak expands in West Texas around county with low vaccination rate. Well, that's great. RFK is going to save us, isn't he? The guy who's like, man, that vaccination rate's still too high. We got to get that bad boy down. That guy's going to come through and save us. So here we go. A measles outbreak is growing in rural areas of West Texas where vaccination rates are well below the recommended level. In late January, 2 children in Gaines County were hospitalized for measles. On Wednesday, the state health department shared in a health alert that the number of confirmed cases had grown to 6. As of Friday afternoon, the outbreak had jumped to 14 confirmed cases and 6 probable cases among people who are symptomatic and had close contact with infected individuals. Zach Holbrooks, executive director of the South Plains Public Health District, told CNN, investigations are ongoing as cases have been identified in parts of the region that are outside the Gaines County lines where the first cases were reported. All the cases are believed to be among people who are not vaccinated against measles, and most of them are children. A record share of U.S. kindergartners had an exemption for required vaccinations last school year, leaving more than 125,000 new school children without coverage for at least one state-mandated vaccine, according to data published by the U.S. Centers for Disease Control and Prevention in October. That's great. It's great. So, I mean, look, what else is there to say? That we are rolling the clock back. Like, the clock is just being rolled back. And, even if you thought 18% vaccine exemption rate for the county, 18%. I mean, these people might want to look into a little thing called herd immunity to see that you kind of need everybody to get the vaccine. But I got more. Oh, by the way, why was it that the measles outbreak happened in the county with the low vaccination rates? That's a tough one. Let's figure that out. Hey, anti-vaxxers, isn't it weird that the measles took off in the place that you had a lower measles vaccination rate? I thought that the vaccine was bad and that, like, you know, there would have been maybe more measles in the place that took the vaccine since it's a scam and since it's bad for you, right? And maybe the measles vaccine gives people the measles, right? Like, this is the sort of idiocy that you hear from these people. Why is it that the lower vaccination rate place and all the people who got it didn't have the vaccine? I don't even know why I bothered, bro. I don't even know why I bothered. Like, I can make the most ironclad argument based on hardcore facts and data and be like, no, I believe RFK. I believe RFK, who was drinking fucking blue dye on an airplane the other day. Jesus fucking Christ. All right, still not done. Egg rationing begins. The largest poultry outbreak in years. Rising detections in mammals, and a government blackout on real data. List of major U.S. retailers limiting egg purchases amid bird flu crisis. Bird flu crisis. As you all know, I think we discussed this the other day. The CDC had published something about how cats are now spreading bird flu to humans. They put it up and then they pulled it down immediately, probably because they were censored by Trump's little sycophantic authoritarian officials. So we're largely in the dark, bro. Look, I've said this to you before. I'm going to say it again. What you need to do is pay very, very close attention to any functioning state in this country, which means Democratic. You need to listen to what their health agencies are saying. Right? What's the California Health Agency saying? What's the New York Health Agency saying? Because they will let you know, like, at the state level, Trump can't take an axe to state level health departments. He can to the federal one. He can't to the state one. Right? And so listen to what they're saying. Because they're like, New York is already saying, hey man, red alert a little bit. You might want to wear a mask. We got all these different things going around. We got the regular flu. We got bird flu. We got RSV. We got this. We got that. And a lot of people are getting sick. You got schools all over the country are out because so many kids are sick. Right? And now we know we got TB, we got measles, that's Kansas and West Texas, respectively. And then we got influenza, standard flu, we got bird flu, we got all this shit. And what's the Trump administration's reaction to it? Defund the health agencies, freeze the communications, and shove our head in the sand. Why? If we have another outbreak of another virus that kills massive numbers of people, this is what you need to understand. The whole plan is to hide it and downplay it and try to bulldoze your way through the scandal through PR and marketing and image control, right? And so that's their goal. Their goal is we're just going to pretend like it doesn't exist. We're just going to pretend like it doesn't exist. Already a nightmare. like I said, we're rolling the clock back. These examples are just like, it doesn't get any more clear than these examples. This is an outright war on every single functioning government institution that we have. Hey y'all, do me a favor and like and subscribe. It helps out big time in the algorithm. Click the bell as well for notifications when videos drop, and watch that video on screen right now. You know you want to.